So it's far more than dermatologic presentations of disease. It's also you said there's radiologic.
Right. So what we try to do is move the community away from thinking about specialties to thinking about problems. So skin-based appearances, you put in your factors, and the diagnoses that come up span infectious disease, dermatology, rheumatology, nutritional disorders. So it's really an approach that says that we can help you identify a disease, and it cuts across all specialties.
Now, do you sell this to hospitals, or how does this work on the business end?
Well, on the business end, we've been licensing this for 10 years, primarily to hospitals and state governments. We have 6 states that have placed it in every hospital in their state. And recently, within the last year, we've made it available to individual physicians over the internet. And now with the iPhone, they can license both the desktop and the iPhone usage over the internet as an individual physician. What's really exciting, besides announcing the iPhone at HIMSS, we're announcing interoperability with UpToDate. I don't know if you're familiar with UpToDate.
I love UpToDate.
Okay, so UpToDate.
And I was thinking that how well that would integrate with UpToDate. And I was going to actually mention that to Denise Beso over there at UpToDate. But you're way ahead of me, ahead of me. So that's great.
So here's exciting news. So UpToDate, the most widely used compendium of knowledge in medicine, 70,000 pages of text, is very text-centric. There's a few pictures in there, and you pretty much search by disease. So the crew at UpToDate really got excited about Visual DX because we bring to them this richness in imagery, but we also bring the ability to search by patient factors. And so in UpToDate, sometime later in the second quarter, you'll be able to search by disease such as gout or Lyme disease and get a results that says view images of gout at Visual DX. You'll click that link if you have a subscription to Visual DX. It's not part of UpToDate. They're separate systems. We're going to be interoperable with them. But joint customers of UpToDate and Visual DX will be able to put the search results into UpToDate, which means that UpToDate users will also be able to search by patient factors. So you're going to be able to search by vesicle. You're going to be able to search by medication and see those medication adverse events.
Do you have some examples of how your tool was used to the benefit of a patient?
I have two great examples I'd like to share with you. One that we presented at the AHRQ Diagnostic Errors in Medicine meeting. We have a user in Sioux Falls, South Dakota, Dr. Myers, who saw a patient that had immigrated to the country, and it was a busy afternoon, and she looked at her list and it said no improvement after seeing a dermatologist. And she scratched her head and said, boy, that's going to be a tough case this afternoon because I'm a family physician and a dermatologist couldn't solve it.
Couldn't figure it out.
So she had Visual DX. In 3 minutes, she entered the fact that she saw scaly lesions and that they were widespread. And in the list of possibilities was dermatitis and the things that other doctors were thinking of, and also was secondary syphilis. She looked in the electronic record, and she said, wow, this immigrant didn't. They usually get HIV testing and RPR for syphilis. No testing was done. She ordered it and confirmed that it was secondary syphilis. So she's a family physician with very poor access. She's in a community clinic. It's hard to get her patients to see specialists because of finances. And she has information technology that helps her to be a better family physician right at the point of care. Another story is we had a family doc who had a patient had some lesions on her leg. And the patient, he was going to refer to dermatology. And at the last minute, with the hand on the door of the clinic room, the patient says to him, my rheumatologist gave me some naproxen for my arthritis. And then he bangs it in like I did, and up comes fixed drug eruption. And he's looking at all the different diseases that are possible from naproxen, and he sees the circle on the skin, and he says, wow, it looks like her. And he starts investigating, and he sees that there's strong literature evidence for naproxen. He swivels the screen, the monitor, to the patient, shows her the pictures, shows her the information, and she says, well, that's easy. I only take it once in a while, and we'll just see if the rash goes away, if the lesions go away, which they did. And he told me the story a month later, and he said, I don't remember learning about fixed drug eruptions in medical school.
I don't either.
Right, but they're very, very common. So the experts know it, but you can't expect primary care to memorize all of medicine.
Right.
And that's what information technology is doing. It's bringing cognitive support to the non-expert so they can start to do a better job with each patient.
So you make family physicians and internists better doctors. You can help them be almost like this is their pocket specialist that's at their side, helping them figure out difficult cases with accuracy. That's really exciting.
Oh, it's very exciting.
Our friends at the American College of Physicians will be glad to know about this, I'm sure. They contribute to our blogs and we contribute to theirs. And this is, it seems to me like a wonderful tool that I would like to use in my practice too, quite frankly. Thank you.
No problem.
That was shameless. I didn't really mean it that way. I mean, I just,
Yeah, all right.
Very cool. So in closing then, Art, do you have any thoughts that you'd like to share with our physician and nurse audience?
Well, I'll make another shameless plug.
Okay, good.
We're on the internet at visualdx.com. You can watch a 4-minute video conceptual overview, and you can license Visual DX, and you can talk to your hospitals about licensing it for their system. It's a system that's widely available and used in 1,300 sites already over the last 10 years.
And you'll be part of Up to Date. That's a big deal. So that's terrific. You've built a great product, and I think that'll help a lot of people. So I'm really glad to talk to you about it today. Thank you so much.
Thank you.